So welcome back to the channel. If you're new here, my name is Vanessa. I am a Nigerian based YouTuber and a content creator. You can always follow me on my social medias on Instagram at official Vani, same name as here on YouTube. And on this channel, we talk about lifestyle vlogs, product reviews and everything just. So of recent, I had a fibroid surgery, and this fibroid journey has not been an easy one, right? And I promised myself that I'm going to be talking about it more just to create awareness, okay? I'm going to talk about it more to create awareness, especially, for women. So if you are a woman watching this video, please and please watch this video to the very end. And if you are a man or a guy watching this video and you have sisters, you have a wife, you have daughters, please do well to share this video with every female, because I'm sure you have female friends, even if you don't have a wife, even if you don't have a daughter, even if you don't have sisters. Okay, you can share these videos with them. Oh, hello, hi car editor, welcome back and thank you for joining us. So today, like I said, we're talking about fibroids. Like I should have done this live earlier before now, or I had created some videos, and all. Please do well to like the video. Thank you. I had created some videos, before now, and I thought, okay, maybe those videos will be helpful, to like one or two persons. But today, let's talk extensively about, fibroids. First things first, I'm not a medical personnel. This is just my personal experience, right? I'm talking about my personal experience and everything that there is to know. Okay. So for you to get a more or a more medical approach, or a more medical aspect of it, you need to go to the hospital for a proper checkup. Please, when you join us, like the live, subscribe to the channel and join the family. Okay, thank you. So first things first, in my last video I talked about what fibroids are. I said there are tumors or there are growth, right, that can be found in or outside of the uterus. So a lot of women these days, of say 25, from the age of 25, down to say 30, 35, they suffer a lot from fibroids. Some are aware of it, some others are not aware of it. The reason why I decided to do this video, right, was because of a case that happened few days back. So I had a senior, a senior from secondary school, like, and I went on Facebook. I was scrolling through Facebook and I saw her sister posted, and it was really sad because she had passed on, and then days after that day, I saw it, a friend of mine posted about the same lady, and she was like, oh, it was fibroid that killed her, and I'm like, oh my god, like that is really sad. Imagine something that can be treatable, right? But because you're not aware of it, it gets to that very delicate stage where it can take a life. So that's why I decided to like do this video, because I need to really stress on the fact that these things are monsters and they can take your life. So please and please, if you're a woman from the age, in fact, as a woman, the earlier you start checking yourself, the better, because you would know if there is anything that is not supposed to be in your body, right? You would know that it's there, and you would start taking measures, timely measures. When you start taking timely measures, trust me, you'll be able to fight whatever is affecting you in one way or the other. So the first things first, these are like maybe possible signs that you might see to know that okay, you have fibroid. For some people, it's about heavy bleeding, right? During their periods, like during their menstrual flows. They have serious heavy bleeding. Some people, they have excessive pain when they are on their period, right? Other people, it's the there's this bloatness that comes with your belly, and some people would say, oh, I am only big on the belly side, it does not mean I am sick or this or that. In Nigeria, they'll say, na big belly I get, I no keep person. That's what they usually say. But sometimes that's your big belly might not just be big belly. It might not even be pregnancy that you're thinking. It might be something else bothering you. Okay, so those are like few of the signs that you might know. And some people's signs are very, very visible, right? Some people, you can feel the lump under, like your underbelly. You can feel the hardness there. That is when they are due, for removal. Now, for some people, you might not feel any of those things, but you can only identify it when you do regular checkup. So when you do regular checkup, you'll be able to identify that, oh, I have fibroid. Now, after you have identified that you have fibroid, what next to do? I'm sure your gyno or your doctor would advise you on what to do. From my personal experience, when I found out that I had fibroid, what I did was I asked them, I went for a scan, and it was just an abdominal scan because I was feeling stomach ache, right? I had like stomach ache, and I was telling my husband about it, that, oh, I keep feeling this ache in my belly. And he was like, okay, go for checkup. So when I went for a scan, they did an abdominal scan, and the person in the scan room said, oh, you have a few fibroids, right? Even at that time, I wasn't feeling that hardness, that stony effect. I wasn't feeling it. So what did I do? After some months, I went back to the hospital for another scan this time around, right? When I went for the scan, hi, Tasha. Thank you for joining us. Good to have you here. Please do well to like the video when you join us. So when I went to the hospital for the second scan, there they did a PV scan this time around instead of just an abdominal scan. The PV scan will help you in seeing, how much you have there, right? So they did a PV scan, and they were able to identify that, yes, this is actually a fibroid, and it was enlarging my uterus, which was the main reason that I had to undergo a surgery, right? Because it was enlarging my uterus. So imagine if I didn't go to the hospital to check myself, to do another scan, like a second scan, just to confirm this thing. How would I have known that my uterus was enlarging? So imagine trying to get pregnant in that state. What are you telling yourself? Indirectly, there are certain things that, I'm sorry to say, but there are certain things that we just disturb God for, when those things can actually be handled, by ourselves through regular checkup in the hospital. So God, who has given those people that level of intelligence to be able to determine that, okay, this is wrong and this is wrong, right? He knows what he was doing when he did that. You understand? He knows what he was doing when he did that. So regular checkups helped a lot. So for me, after the second scan, I went to see a gyno. They said I needed to see a gyno. That's a gynecologist, right? And she was the person that said, okay, I can feel this thing. Even from just touching my stomach alone, she could feel that these things were there. And the next thing that came out of her mouth was, oh, we have to take them out. Because if you try to get pregnant, there might be complications. Now, you can see that, like I said, these are things that can be avoided if only you do regular checkup. So, good thing that I had to do a second, checkup to be able to identify that, oh, this was fibroid and this was the sizes and they need to be taken out. So after that, we started planning on a possible date for the surgery, right? Which is called a myomectomy surgery, because it's they have to like open your stomach to do the surgery, unlike other surgeries that they do. Because when the fibroids are little, there are other surgeries that can be done to take them out without necessarily doing an open surgery or an open myomectomy, right? So for me, I had to go through that aspect of doing an open myomectomy because, one, there were a lot, and because of the sizes is now, it has gone from that stage of, the little ones, right, to bigger ones that cannot pass through out, like through my vagina anymore, even if they try to like take them out through the vagina, right? So we decided that, okay, we're going to go for the surgery. It's not an easy decision to make, but when you know what you're fighting against, when you know what is there, you don't have a choice but to take them out. The earlier, the better, because these things, they can take your life. When it gets to that stage, right? When it gets to that stage that it becomes too difficult for them to take it out, or it becomes it starts affecting your life, right? The next thing is they will either tell you to leave it alone, and something else may happen, something negative may happen. So also in the hospital, if you are maybe above like say 35 and you're close to menopause, there and maybe it's big, they might not necessarily take them out because the moment you get to menopause, the fibroids shrink by itself. But now let me address something. For the people that like to that take these herbal medicines and say, "Oh, I want to take agbo because it's going to cure it or it's going to shrink it." Please and please stop deceiving yourself. I don't know who helps that has helped in terms of fibroid shrinkage. I do not know. For every lady that have gone through this process that I've spoken to, they all went through the medical route by taking them out through a surgery. So do not harm yourself by saying, I'm going to be taking agbo, it will shrink it. Agbo will not shrink it. In fact, if you don't take time, agbo will increase it. That is the herbal medication. Agbo will increase the sizes, and then causes more complications for you. Okay. Hi, Move Some. Thank you for joining us. Good to have you here. Good to have you here. Thank you so much for joining us. Please do well to like the video when you join and subscribe to join the family as well. Thank you so much. So today we're talking about fibroids and how harmful it is to women. Okay. So if you have a sister, if you have a wife, if you have female friends, please do well to share this video with them so that they can learn from it, because this is me speaking. Okay, so my channel is about lifestyle. We do vlogs, we do product reviews, and we do everything gist as well. So this is just me talking about my personal experience with fibroid. I'm not a medical person here. I'm just a normal person, right? But I like to share my experiences here for other people to learn as well. So yeah, yeah. So I went through a fibroid surgery just a few months ago, like I think about a month ago, and I decided to share this, with other ladies so that they can understand, some of the issues that come with it. So for some people, right, they try to like take in. Some people have difficulties in taking in. I want you to also know that fibroids can also impede pregnancies as well. So if you're finding it difficult to get pregnant, that is if you haven't gone through like the hospital route and everything, you might want to also check yourself, because the earlier you notice these things, the better for you. When you notice early, it's easier. For some people, what they do is that when they notice that they have fibroids, maybe they are like, smaller ones, they try to take in. When they are taking out your baby, right, they take out the fibroid as well. Please go ahead with your questions. I'm here to answer them. If you have any questions at all relating to fibroid, whatsoever, please do well to ask, and I would definitely answer as long as it's within, what I know. I would definitely respond to it. But I can tell you something for free that the how long have you been on YouTube? Oh, okay. I've been on YouTube for a year and some months now. I think by October it would make it 2 years exactly. Yeah. By October, it will make it 2 years exactly. Thank you so much for your subscription. Thank you very much. So yeah, so back to the discussion on the fibroid, and how it affects, women and all of that. Thank you very much. Thank you. I'm so grateful for that. You're doing great. Thank you very much. So for if you've noticed like any signs whatsoever, like I always say, if you've noticed any signs whatsoever, maybe you're having stomach, pain, you're having heavy bleeding during your periods, or your periods are like irregular and things like that, go to the hospital and check yourself, because aside from fibroid, there are other things that can also be causing that as well, right? But bottom line is, make sure you're always checking yourself on a regular as a woman and even as a man, but it's only women who faces fibroid, so and also for the surgery, right? If they've noticed that the fibroids are big enough, I was saying something concerning, when you're pregnant, some people take out theirs when they are, taking out their baby. The only thing is that instead of doing like a vaginal birth, you will have to do like a CS, like a C-section, right? That's like the only thing, because there was a woman that she had like 3 C-sections before, this whole fibroid thing, because she also had fibroid and she needed to take them out in the same hospital where I did mine. and she had had like 3 C-sections before. Usually they will advise that once you've given birth like 3 times, you should stop. No, that should be enough because you don't want to complicate your health, and all of that, right? But in this situation, they had to like cut her again just to take out the fibroids this time around. So if for her, if she was maybe close to menopause, I'm sure they would have let it lie because they know that when you get to menopause, it shrinks. So they wouldn't really like bother so much. Okay. So for the surgery aspect, right now we've known what fibroids are. We've known like you know what are the symptoms that you can see. And for the causes, I do not know what causes fibroid. Like I've tried, I've read, although in this era, because in most cases, like when you go online to like research on it, they'll tell you most of the women that have it are like those in Africa and those in like I think the Mediterranean also I've seen. And or like blacks in general, like blacks in general and all of that. But I've seen like other videos, people that are not black, or maybe they don't even have like black roots and they have these things as well. I've watched like a lot of videos here on YouTube of ladies talking about what they've gone through, and the rest of it as well. And so there hasn't been like a particular cause, but in some cases they'll be like, oh, watch the kind of food that you eat, watch the kind of food that you eat, those things might be the ones causing it or the enlargement and all. Because of recent, it has become very rampant. Like if most of the people that I've asked that have gone through the surgery that I've asked, most of them they said the same thing. Like there hasn't been like a particular reason to say, oh, this is what is causing the fibroid, right? So I don't know if it's like just a now thing or if it has just decided to like become very very rampant. I don't know. I really don't know, but I don't know like the particular cause. So, but from whatever like I know, I can say that whether you know what is causing it or not, as long as you've noticed that you have it, just try and see a doctor to like know what next you need to do. Okay, because people are going from this like people are losing their lives. You may look at it as if it's nothing, but trust me, I know why I'm dropping this information here. I know why I'm doing that, not because of, oh, I just want to like talk, or I just want to like I like just talking about it, but no, because it will help someone, and I know it will help 1 or 2 persons out there. Even if this video gets to like 1,000 people and maybe it's just one person that decides to pick something from this video, then that's fine. Then I've actually been able to like save a life, you know so now moving to the aspect of the surgery. So when they said that okay, I was going to do a surgery and all of that, we just needed to prepare. So what I did that helped me like very well was the fact that mentally and psychologically I started preparing myself. I had undergone a surgery before, but it was for appendicitis. So I just tried to like put myself in that situation again where I say, okay, I may not be able to move for so and so period of time, even though they are different, like the procedures are different, the after feel of the procedures are different. I will tell you that for free, you know. But psychologically, I started preparing myself, and that really helped me a lot because there were certain things that maybe I would have been like a bit shaken, but I wasn't because I had already prepared myself. Also, I was praying a lot. Like I was praying a lot about it. I was telling God, if it's the path you want me to take, then so be it. Okay. So like after the visit to the hospital, it took like few, I think a week and some days before I went back to the hospital for the surgery this time around. So when I got to the hospital, like, oh, they needed to like, do 1 or 2 checks. What I did was that one, you have to provide a donor because they need blood. So for them, they don't want to. No hospital would go through that surgery, right, without having like blood on ground or a donor on ground. They won't do that because in case of emergencies, like in case you need blood donation, that's not when they'll start like going around looking for who will donate, who will not donate blood. I'm sure you understand. So what I do is that they make sure that there is one standby, like there is already like blood standby. So if you don't use the blood, at the end of the day, they will not give it to you back. They probably will use it for like another patient. Okay. But they would have to get blood for you just in case of any form of complications, or maybe you're bleeding too much, like when you get to the theater you're bleeding too much and all of that. When that is when they have already cut you, they would definitely need to have blood standby, so you should know that. Okay. And also, we were meant to like get some things when we got to the hospital. Things like we had to get like this container to use and collect like the fibroids, right? So depending on how big yours is, I think I had about 16 of them removed. So depending on how big it is, they'll need like a container. You need like pad. This pad, because after the surgery, you would be bleeding for some days to some weeks, depending on your system, right? So you might bleed for like let's say the first week to the second week, and then it starts reducing that maybe then till before your period comes and stuff like that, right? So and then another thing is that your first few periods might be different from whatever you have been experiencing before. Like for me now, my first period, like immediately after the surgery, was it just lasted for 2 days. For me, my periods are usually like 5 days, but that very one lasted for 2 days, and the flow was nothing compared to like before. Then the second period I had like after the surgery was like intense. The second period after the surgery was very intense. It was like a whole, it was like I was just bleeding. Like that period, I used to call myself the woman with the issue of blood, God forbid. But I was just bleeding. And on a norm, I used like 1.5 pad for like my 5 days period, highest two. But I finished 3 pads in a space of 5 days after the surgery. Like, so I when I started checking, like researching on it, I found out that it was normal. So they are like, okay, your period, like your first three periods might be different from what you were feeling before. And I had severe cramps. That I will tell you. The cramps were so crazy, like I was gonna go mad. I couldn't sit down, I couldn't stand up. I was just, I didn't know what I wanted to use myself for. But I knew that the cramps were terrible. They were more than what I used to have before. The cramps was way more than what I used to have before. So yeah, so that happens, and you will need like there's this kind of hospital pad that they give to you, like they put it on your bed. They put it on your bed so that in case like you're staining like the sheets or something, like you stain that pad and then they just roll it over. Then another thing is before you go even into the surgery, they put like a catheter like into your vagina because you are going to wee. And if they do like the surgery that I say today, you cannot stand up and start weeing immediately because you can't even walk because your legs are still numb. You're still trying to like recover. Your legs are still, of course, they've given you like that injection. And so because of the anesthetics that, or yeah, that they're going to be giving to you, or anesthesia rather, that they're going to be giving to you, you cannot move your legs, right? So because of that, they'll put a catheter through your vagina, which is where you're going to wee from, at least for the first 2 days, before you can, start getting up and start working by yourself, and all of that and all of that. So that's another thing that you need to know. Then okay, then in the surgery, in the theater rather, right? In the theater, when they are operating on you, you might even be, in fact, they can be gisting with yourself, but you're not going to be feeling anything. The only thing is that you're going to be feeling like some drags, right? You're going to be feeling like some drags here and there, but you're not going to be feeling pain, but you're going to be awake. You might even be seeing, because although they create like a barricade between you and the doctors, so when they are operating on you, you might not necessarily see where they are cutting you and things like that. But for me, as a smart girl that I am, I was awake all through, and the lights in the theater, I could see like the reflection of what they were doing through there. But I wasn't scared because I couldn't feel any pain. I was just feeling like the push and pull. They were dragging me, like, I feel like they were dragging my organs. Let me just say it like that. So that's another thing you need to know. And before they even start the procedure, they are going to like use some, I don't know, it's like, I don't know if it's like spirits or what, but it's kind of shocking. It shocks you like electricity. But I wasn't scared because I had already like prepped my mind and everything. So when they were doing it, I wasn't scared. Like even the doctor, the surgeon was like, you have mind, or like this is where a lot of people get scared, but like I wasn't. So they clean you up, and everything, and then they do like the procedure, sew you back, and they move you, they move you like back to the world, right? For me, I was even awake even after, the procedure. I was awake, moved me back to the world. I was awake. I saw my husband, I saw my mom, and thank God before I started trying to like sleep a little bit, so that's on that side. So now after the surgery, okay, so 2 days, like I think a day or two after the surgery, I the night of the surgery, I was feeling like a little bit of pain. So they came back and gave me more of the pain medicine. So for that kind of like helped, because after they gave me that pain medicine, I was able to sleep, but they didn't remove the catheter because I couldn't walk yet. The next morning, like that, until like the second, I think the third day, that was when I started moving, because then I had to like remove this thing in my spine, and I had to remove. So when they took that out, I could the anesthesia like weared off, and then I started moving by myself, like getting up to go wee, getting up and all. So when you are bleeding after your period, do not be scared. After your surgery, rather, when you bleed after your surgery, do not be scared. It's normal, because all of those things, they have brought out your uterus, they have cut, and things. So you don't have to be scared and be saying, "Oh, I'm bleeding" or something. No, it's like a discharge. It's not like even like bleeding. It's going to be like a discharge, but you're going to be seeing like blood in it. So it's just your system, like, passing out like whatever is there, and but after like a week or a few days, you'll be totally fine. Like the discharge will stop and you'll be coming back to like normal. So after you're going to stay in the hospital for like another three 3 days, or like for me, I said like 4 days, 5 days, 4 nights. Yeah. So after the surgery, they'll discharge you once they know that you can walk and you're healing fine and your appetite is getting back gradually. You can start taking things like Lipton, like hot Lipton, hot water, little by little. Please do not take cold water. I always advise, don't take cold water like after your surgery immediately. You can't be doing that to yourself. It will cause you complications. I will say that for free. I've seen people pass through there and gone before. So don't do that. So they will start you with like after the third day, they will start you like Lipton. The Lipton is going to be hot. It's not like you're taking this and then you start taking pap, gradually. Then once they notice like your bowel movements, as long as your bowel movement is good and you can start going to the toilet by yourself, right? Then that means you're just fine. Okay. So we left the hospital, came back home. So when we came back home, for me, I wasn't using number two. I was only doing like number one. So when for number two, it took me like some days because I was not eating. I wasn't eating like properly. I was taking more of pap, and with pap, you just wee out, and that's the end of it. So it took me like some days to start eating. Then I was taking pepper soup, like fish pepper soup. I was taking with like a lot of pepper, just to make sure that it helps with like the healing as well, and it also helps with my stomach, like my bowel, movement as well. I wasn't taking anything heavy because I did not want to go and be forcing myself doing number two. That's one thing you should know, because if you're taking hard food that period, it's going to be very difficult. See, I think this procedure kind of made me realize that we need the muscles in our stomach, right? We need the muscles in our stomach to push when you're doing number two. You need the muscles in your stomach to do all those things. So it is when you go through this surgery you would understand that you actually need those muscles. So for me, I was making sure that I took very light food, very very light, like pap, the pepper soup I mentioned. That way, it's easier for me to like pass out, physics and stuff like that. You understand? So, and then I took another thing that helped me was that I took garden egg. Garden egg is very good for your boil as well, because it kind of like loosens everything in there. Like it will make it easy for you to do number two, like easily, like without having to like really stress yourself. You don't have to like stress, and then you don't want to have constipation when you do this surgery. You don't want to have constipation as well. So yeah, I'm just giving you guys points, things that can help you if you've gone through the surgery or about to go through the surgery, right? Because we've talked about, what fibroids are. We've talked about the signs of fibroids. We've talked about if you have the fibroids, what you should do, by going to the hospital, talking to your gyno and things like that. And now this is like post operation, things you should know like after the surgery has been done, right? This will help with your healing and everything. I'm still healing. Like 2 months now. By the grace of God, on Friday, I think I'll be 2 months, post OP, but I'm still healing. So you don't have to force yourself to do anything that period. You have to give yourself time to heal properly, because externally you might think that you've healed, but internally you're still healing. You don't want to anything that will cause you complications for you to go back to that hospital bed. Now that I'm saying the story, it looks more easy, but trust me, this is not an easy one. And to avoid a lot of things, that is why I'm bringing this back here, because some people, just a few days ago, I said it here that I noticed that someone had passed on because of what? Because of thyroid. Hi, Anthony. Good to have you here. Please do well to like the video. Thank you so much for stopping by. So today we're talking about fibroids and how much it affects women today. A lot of women are battling with fibroids, and this is just me just trying to put one or two informations out here for us. Thank you. Thank you. Thank you so much, Anthony. God bless you. Thank you. Please do well to like the video. Thank you. Happy Sunday to you too. Happy Sunday. Okay, so back to what I was talking about, right? So after the operation, once you're back to the house, you start trying to eat like little by little and things like that. Now, another thing that you might notice is sleeping, your sleeping posture. You cannot sleep on your stomach, you cannot sleep on your stomach, you cannot sleep on your side, because you're going to notice some form of movement when you try to sleep on your stomach or when you try to sleep by the side. It's going to feel like all your stomach is shifting to one corner. That's how, thank you, Anthony. That's how you're going to feel. When you feel like lying to your side, you're going to feel like all your stomach is shifting to one corner. That is because your uterus and everything has been brought out for that surgery to be performed. So your uterus and your organs are trying to find its way back to its position. So because of that, you are unable to sleep the way you like. So for sleeping position, the best way to sleep that period is you use like two pillows to wage yourself, okay? Wage yourself by the side, and then you sleep on your back. At least for the first 3 weeks to 4 weeks. That's going to be your sleeping position. I think now I have started to feel like better when I sleep on my side. I don't feel that heaviness in my stomach anymore. That's because we are what healing, and the organs are like already locating itself like back to their locations, right? They're finally locating where their sockets are, and they're fixing themselves there. So that's another thing you need to know, and that's about sleeping position. So what else have I not spoken about? So for that aspect of like your stomach shifting, that's like the most scary part of it, because you literally would feel like your stomach is shifting. Like, that's, it's not a joke. You will definitely feel it. So don't panic when you're feeling it. It is just your uterus. I didn't have some of this information before going into surgery. I had to experience them myself. And that was how I knew that, okay, this is what it is. This is what it is. So yeah, please, by all means, know these things. And like I said, if you have sisters, wives, share this video with them. Let them learn about this fibroid, because it's causing, more harm than good right now. So the ladies, it's causing us more harm than good. So yeah, that's it. So after that, you can start eating, your meals will like maybe noodles, little like rice. You can start eating. Like in the hospital, they'll tell you, oh yeah, eat everything, but please don't jump into eating everything. Eat as your strength can carry you, little by little. And then another thing is that helps a lot is try to walk. Don't just lie down all day. Walk as much as possible. So if, for example, like day one, you walk for like 5 minutes, you get tired, you come sit down. Day two, try to make it 10 minutes, right? Day three, try to make it 15 minutes. You can walk around your house. You don't have to go out because you're still all bent. You're still like bending. You're not standing straight yet. So you don't want people asking you questions like, oh, what's wrong? What's going on? You don't want that. Okay. So because of that, what you would do is you can walk around the house. So for me, I was just walking around like the living room area. I was walking around, walking around. I make sure that every day I walk. I walk in the morning, I walk in the evening. My husband won't even let me out of the house that period. So I just take a walk, inside. Like, I just walk, try to make sure that I am moving at least. I am not just sitting down in one particular place. Because when you sit in one particular place, that can also have its own effects, like side effects on you too. So try to move so that as you move, your legs get stronger. You feel much better each and every day. Take hot water. You can take warm water as much as possible. Avoid anything cold, water for the meantime, right? At least for the first 1 month. Okay, then in the hospital they will still give you medications, and watch your wound as much as possible. Okay, watch your wound, like always be keen when you're cleaning it, because they'll tell you you get like spirits, you get like iodine that you can use on the injury, right? So you clean with the spirits first, and then you use the iodine on it to help with like the external healing, like the face and all. So these days, what they do is they don't do like those stitches where they have to lose anymore. Okay, so they do the ones that either dissolves by itself, or there's this other one they do. So for me, they did like the stitched one where it dissolves by itself. So as you're cleaning day by day, before you know it, as the injury is healing, the thread is coming off by itself. You don't even have to do anything. It comes off by itself. So yeah, unlike before when you have to like go to the hospital after like 3 to 4 days, and then they have to like take out the stitches. They don't do that anymore. Medicine is advancing day by day, so you don't have to be scared of like the losing process. They will not lose anything. Once they've stitched you up, they've stitched you up. All you need to do is just to continue to wipe and make sure that place is clean and clear. So for baiting, for me, what I did, like for the first few days, I was doing towel baiting. My mom was helping me because I couldn't like stand really very well. So I would sit down, and then my mom will use like towel, dip towel into water. First we'll use sponge, right? So if I use like sponge on one hand, we use towel to like clean it with clean water. Use like sponge on the other hand, use towel to clean it, like that. That's for bathing. So for some people, they will decide not to like bathe. They don't want water to touch them for. But trust me, I couldn't stay. Me, I like to like tidy myself, like no matter what. So that was what I was doing. I was making sure that at least we do towel bathing, so that I feel fresh as well. You feel fresh, and everything, so that it doesn't look you don't look like you're even like sick. Okay, it will help your spirit too. It will help you in general, like to feel better as well. So that was what we were doing for like the bathing aspects. So we were doing towel bathing for like at least a week. So after like a week, once they took out the plaster, once they took out like the plaster from the surface, I started bathing normal, but immediately I finished bathing, I would wipe that place dry. So make sure that your incision is always parted like dry. Don't like allow water to like stay on this thing. So when you pat it dry, you use your spirit to clean it, then you use your iodine as well to also, apply the iodine on it. It will help with like that surface area as well, and to keep it like all neat and tidy. So and then another thing is the medications. They will give you medications from the hospital, like antibiotics, vitamin C, and then folic acid. So the folic acid, you would take it for like a very long period of time. The folic acid will help with your system in general as a woman, right? It will help you with like fertility sort of, right? So you want your system to come back to normal as quick as possible, so that you can now think of, okay, do I want to like start having babies, and things like that. So in also the hospital, they would advise that you shouldn't like have sex like immediately. At least give yourself like a month, and some weeks thereabouts. So when you go to the hospital, they will start asking you these questions like, oh, are you like having sex yet, and things like that. So I would say, if you're somebody that cannot hold yourself, please, you will try and hold yourself that period. Your husband or your wife is not running away. Your partner is not running away. Okay. So please give your partners time. Men, this is for you people. Give your wives time to heal very well after a fibroid surgery, or after like a CS, any form of CS at all. Give your wives time to heal very well, so that you don't go and cause her any form of complications. Because I know that, yes, you want to have sex and all of that, but it cannot be immediate. You give it time, at least 2 months. Like I think after 2 months, the doctors will tell you that, okay, you can start, little by little. And the thing is, you don't want a situation whereby, because this is somebody that her tummy is still big, right? The place of the cut is still swollen, right? The uterus is still trying to shrink back to its normal size, right? So you don't want to apply pressure on someone's stomach, and then you feel like, okay, nothing is going to happen. You might cause her more harm than good. So please, men, give your partners time to heal properly from every form of C-section, whether it's a C-section to have a baby or C-section to remove fibroids. Give them time to heal properly before you go back to your sex life. Because trust me, you can't even be very rough with the person. Like when you go through the surgery, you can't be doing all that rough play. For me, so this is me, that I'm somebody that I like to play a lot, like in my house. My husband knows that like I enjoy playing like a lot. I can just stay and jump on him and but I can't be doing all those things when I am trying to heal, right? I try as much as possible, to stay clear of rough play, till at least I am healed enough. Right now I play, and all, but I don't play anything close to my stomach region. I don't want wahala. I don't want to go back to the hospital. So that's another thing that you need to know that about the sex aspect when you are done doing your surgery. Give it time. Don't be in a hurry. I know that the hospital might say, oh, they want to register pregnancy like in another 6 months, like in 6 months, like at least 8 months, they want to register pregnancy. I know, but there's time. Give yourself 2 months. You will not buy like sex is not food. When the time comes, you will have it and have it in abundance. Okay. So please and please do not say you want to have sex with your partner when they go through any form of these surgeries. Give them time to heal properly. So yeah, I think that's like another aspect. Then which other thing that I might forget, because I really, really want this video to be as informative as possible, and I want it to like so that you can anybody who is watching it can you can't watch this video and afterwards you not pick one or two things. You definitely pick one or two things. If you're planning on going for a fibroid journey or a fibroid surgery, or if you've gone through it and maybe I just like a newbie and all of that, then these are things that you really, really need to like put into practice. Watch, get to know, just grab the knowledge as much as possible, because this is a free information I am giving to you. The best you can do is to watch it, pass on to another woman to also watch and learn. Okay. So what other thing? What other thing? Okay, so for me, I resumed work. That video is even going up today of me resuming back to work. I resumed work after 3 weeks of break that I was given. So if you are not a 9 to 5 worker, right? If you work from maybe from home, or if you're an entrepreneur, it's even better for you because you would have more time to stay at home and heal very, very well before you start going out. But then again, going out also helps in like it just helps elevates your mood and all of that, because you're not tied into the house, just sitting down there doing nothing. Okay. So for me, I had to resume back to work because a lot of people ask like, how soon can I resume back to work after a fibroid surgery? And when I was trying to like do my research, they were like, oh, 4 to 8 weeks. That's about 2 months. You can stay at home for like 2 months before you resume work. But if you're a 9 to 5 worker like me, right? I think after 3 weeks, as long as you don't have any form of complications, I think you'll be good to resume work. It's just that you don't have to do like any strenuous activity. So depending on the kind of work that you do, for me, I'm an administrator. So most times is basically like paperwork, right? It's basically paperwork. So if you are an entrepreneur and your work is not like very, very stressful, you can stay in the comfort of your home and do it. If you are a 9 to 5 worker and you are also not like doing like very strenuous activities, if you're doing more of paperwork, yes, you can still do that because you're just going to sit and do your work. Okay. So it's not like you're going to just go to work and go and be running up and down. You can't be doing that. Please don't put yourself in trouble, trying to please anybody. You first. If anything happens to you, you're going to be replaced like before you know it in that workplace. So please and please, after a fibroid surgery, also speak with your doctors. Like because you're going to be going for like regular checks up and reviews in the hospital. For me, I'm not even done with my reviews. I still have like one more review in the hospital. Okay, so like they're going to be checking you for at least up to a month, up to 2 months, to make sure that everything is fine before they can tell you to, okay, you can stop coming to the hospital, you're fine. So, and if you notice like any slightest pause on your incision, right, please call your doctor immediately. There was a day that I noticed something on my incision, and I had to talk to my doctor immediately, and he said go to the hospital immediately because they work for 24 hours in that hospital. So he said go to the hospital immediately, let them go to emergency section, and they know what to do. And he called when I got there. The doctor I met, I spoke to him. The doctor called him immediately and told him, okay, I was here, in the hospital and everything. And they gave me more antibiotics to take. They gave me flagyl as well. I took all those medication and I'm still on medications up to date, but it's more like folic acid and vitamin C. So there are some medications that you will take for like the longest period of time. There are some that you might not really take so much, maybe like after you finish like a particular dosage, as long as there is no issue, I'm sure you're good to go. But in whatever you do, talk to your doctors as much as possible. They know what to advise. They know what to advise. They will advise you to do the right thing so that you can heal properly. You don't want to have any form of complications after your surgery. That would be them opening you up again, and you wouldn't want that, because this time around they will open you up without giving you any form of anesthesia. I don't want that. I don't want any form of knife going into my skin again. So yeah, so that's that. So for the work aspect, like I said, you can resume. For me, I resumed work after 3 weeks, and that was because I started feeling better, and I also wanted to like walk around, and because of the nature of my job. So if you're like a factory worker, for example, that's like a very strenuous work to do. You wouldn't want to resume work. You would want to stay back at home and heal properly. So if you can take at least up to a month break from work, which is 4 weeks, I think you it will be better, so you can get better properly before you resume back to work. So what other thing? I think that's like basically it, right? So if you guys have like any questions, that is in case I've missed anything so far. If you have like any questions that you would want to ask about fibroid, the surgery, and anything at all, feel free to ask me in the comment section. Even after this video must have dropped on YouTube, feel free to ask any questions in the comment section, and I would gladly respond to those questions. So like for the cut, some people were asking, like in the last video I posted, that how is the cut. So for me, it was a section cut that they did. For some people, they do like a cross-like section, so they tear them from their navel downwards, and then the C part. That's because maybe that theirs is like very big. Some people, they also remove their uterus in the process. That is the if the fibroid is like, maybe it has really affected your uterus, they will have to take out your uterus, and that means you cannot have like a baby anymore, because if you don't have a womb, where would the baby like grow, where would the baby be, things like that. So those are things that's why I say this thing is very harmful to women these days, and it is very, very important that you talk to your doctor when you start feeling any of the above sign mentioned, because you see that excessive bleeding, it can also lead to anemia as well. Yeah, excessive bleeding can lead to anemia, and before you know it, you're feeling like lightheaded and all of that. Before you know it, you're treating fibroid, but you're also treating anemia as well, which is not good. So please, if you notice like any of the signs, if you're someone that have like heavy bleedings during your period, or you have very painful periods, or you have like a very bloated belly, and you feel like this belly is normal. Some, like I said, some of these bellies, they are not normal. Try as much as possible to talk to your doctor about it. Go to the gynecologist, let them check you, let them do like a proper scan on you, okay, so that you know what you're fighting. All right, that way you can avoid certain things as much as possible. Like, I don't think there's any woman out here that wouldn't want to have a child, right? Unless it's like for personal reasons or maybe medical reasons. I don't think any woman would want to say, oh, I don't want to have a child. We women, we love babies. At least most of us love babies. We want to have like our own child. We want to take care of children, and things like that. So when things can be avoided, it is better we do them and they get avoided. Okay, don't go and be saying, oh, let me pray to God. God can heal. That is not even something to dispute. God can heal, but there are certain things that God too would want you to use your brains, and not just be troubling him all the time with saying you want to pray, to God and let God heal you. There's certain things that you yourself, you have to do your own due diligence, so before God will come to play his or her role, his own role, in it as well. So please, and for me, like I said, I was always very prayerful. Like, during that period, I was praying, telling God to like send my healing through the doctors that, or the surgeons that were going to perform the surgery. I was always telling God, please heal me, heal me. And so that's it. So before God will even do his own, you too, you will do your own. Even when he talks about blessing the works of our hands, if you don't have like something to do, if you don't have like a handwork, what will God bless? Think about it from that direction. Like, okay, if I don't have something doing, God will not bless anything. Do you understand? So by all means, please and please and please do your own due diligence. Check yourself very well. Fibroid does, do a lot of harm than good to women. It's just that I think now it's coming out more. People are talking about fibroid more than before. A lot of people get shy of talking about these things. I can't be shy of talking about it because I feel like God has given me every reason to talk about it. God has given me a reason to help another woman out there. So why should I keep quiet about it? Why should I say, oh, I'm shy of talking about fibroid when I'll be saving another life out there? Think about it. So please and please, and if you've gone through a fibroid journey or surgery before, please don't forget to like talk about it in the comment section. Give other women hope by talking about it. Let them hear your story. Let them learn from it. Maybe you made one or two mistakes like during the time you had like your surgery. Talk about it. That is how we would all learn. When you close your mouth, people cannot learn from you, right? So for me, I prefer to talk about it so that we can all learn, from it. I am learning as the more I talk about it, the more I get to know certain things about it. When I experienced it, it helped me to like get to know more about it. Before, I would have just like, oh, after the fiber journey, I just keep my mouth shut and that's it. But no, if I keep my mouth shut, how would other women in my circle learn about it? How would they know that they are battling with fibroid as well? You understand? So feel free to talk about it. There are so many ways. In fact, the earlier you notice it, the better. I think I've said it before. The earlier you notice it, the better because there are lesser invasive surgeries or procedures that can be done without having to give you like a C-section, right? Depending on the sizes of the fibroid. So if you notice it early, it's for your own good. Don't be shy and ask your gyno questions. Me, I say I asked my doctors, I asked the gyno, I asked them questions because I want to know everything. Like I want to know what I am, up against. I want to know everything. So ask questions as much as possible. Don't be shy about it. We are women and our system go through a lot of shit as women. Our systems go through a lot of shit. So talk about it. And I always say this thing like for those people that shame CS moms, you guys, shame on you actually. Shame on you because you don't know the pain. It doesn't matter whether you have your child through your vagina or you have a child through a C-section. Some people would say things like, oh, women who give birth through C-sections are lazy. No, no woman is lazy. You understand me? Because you see that period of recovery from C-section, it's not easy. That period of recovery is no joke. I tell you that for free. It is no joke. So when you shame a woman that is giving birth through C-section because you gave birth through vagina, then there's something wrong with you. Like obviously, you understand. Don't shame any woman. As long as the woman had that baby, trust me, you are both equal. Whether you're giving birth through your vagina or you're giving birth through C-section, don't shame don't shame any woman, okay? Because it's not an easy journey. Our bodies go through it a lot of things. Our body go through a lot of things as women. So please and please and please do not shame any woman, okay? Do not shame any woman, whether they are doing vaginal birth or they are doing CS birth, and you still have a child at the end of the day. That's all that matters. So don't shame any woman and say, oh, you gave birth through CS, or me, I gave birth through vagina. It's not an easy journey. The woman's body go through a lot. And I appreciate every woman out here. You guys are strong. Women, you guys are strong. You are who you think you are. God has given us that supernatural power to be able to take whatever is thrown at us. And I'm proud to be a woman. I'm proud of each and every woman out here. You guys are the real MVPs. Men, please treat your wives as the queens that they are. Okay? Because these women, they go through a lot of shit. I can't even overemphasize it. Please. Men, treat your wives as the queen that they are, because giving you a life as a child is no joke, man. It's just like you're signing your death warrant. It's just like you're saying that, be it alive or dead, like just I'm gonna do it. The stages of pregnancy, talk more of like the delivery period. This me, I've just gone through a C-course procedure and I feel the way I feel. So talk more of people that they've gotten pregnant, spent 9 months in that journey, gave birth, they are taking care of the babies until that baby clocks like at least 1 year, 2 years. Your life cannot get back to normal because right now you're going to be living a life for that child, not even for yourself. So men, women are making like a lot of sacrifices, and the best you can do for that woman is to treat her, support her, encourage her. Don't make her feel like, oh, my body, your body is anyhow, like, oh, after giving birth, your body is like this, your body is like this. Don't make a woman feel like that, because you're just going to create an enemy within, like, without even knowing it. So encourage your partners as much as possible. And having an encouraging partner is like one thing you can thank God for. My husband was like the best support system, when I had my surgery, because he made me feel seen, he made me feel heard. He would, like, if I want something, he runs to get it, because he just wants me to feel better as quick as possible. He was like very supportive, and I can't even thank God enough. So having a supportive partner is something that you can do for your wife. Like, that is like the best gift you can do for your wife or your partner, be it man, be it woman. But in this case, we're talking about the women. So please, men, support your wives as much as possible. Encourage them, be very positive. It's the positivity of my husband that even like held me down the most, because when I was going to like the theater, he said something. He said, "Go and come back, I am waiting for you." So imagine if you don't have a supportive partner, to give you like positive and kind words. How are you going to feel? So in all, be it surgery, be it fibroid surgery, be it any form of whatever it is, in any situations rather you find yourselves, just be as supportive as you can. Women, you too, you can be supportive to your man as well. It's not only men who should be supportive. So yeah, be supportive to your man as well. It helps to keep the family going. It helps to create a very enabling environment, okay, for both of you. So that's just it. So I really, really just wanted to put this video out here, because I thought it was going to be more interactive, because I wanted women to like ask questions that maybe they needed to know, so that I could answer one or two. But it's Sunday, so maybe some people are still in church. But if you come across this video anytime, please leave a comment. You can like the video, leave a comment, ask your questions, and I would be here to respond to those questions. So yeah, it's your girl again, Vanessa, and thank you so much for everyone who also joined us. Thank you guys, the new subscribers, the old subscribers, everyone that passed by and said hello. I'm really grateful for you stopping by. And also, please do not forget to share this video with your loved ones, so that they can learn from it. Okay, I'm not just sharing my story because I want to share it, but it's because I want you to learn from it. I want you to learn from my own experience, okay? And we don't want like the mortality rate to be high, okay? We don't want the mortality rate to be high. We don't want any form of death cases, or because of fibroids, or maybe because of one information or the other that you must have missed, okay? So these are things that you can also do your research to elaborate more on it. Do your research, read about things like that can impede pregnancy. Read about it, even if you're not looking at like having a baby yet. Just read about it. Sometimes you're just saving someone else, without even knowing, because when you have these informations like at your fingertips, it's easier to like advise people when they go through the same thing. Okay, so basically that's it. I just really wanted to drop the video real quick. Just this period that I had this surgery, like, I know how many people have called and said, "Oh, me too, I just went through the same thing. Me too, I'm going through the same thing." You understand? So you never can tell who you're helping. Imagine if I did not drop the video, maybe people wouldn't have even reached out. They might just like, "Oh, let me keep it to myself." But when you speak up, when you're going through things and you speak up, people also like talk about theirs as well, and it makes like the whole thing more fun and more like educational. So yeah, so that's that. I don't think I have any other thing to say. Yeah, I'll be waiting for your questions. Okay, be waiting for your questions as much as possible, and I promise to bring you guys all the little gist I can lay my hands on. I promise to bring gist your way. More videos coming up on this channel. I promise that this year, and I am going to fulfill it. Okay, so stay tuned for more videos. Stay tuned for more discussions. Okay, and stay tuned to us bringing in more guests. I plan on having so many things like to do on this channel this year, and I really, really wish to accomplish it. And I pray that God gives us the strength to also do that this year as well. So if you're yet to subscribe to the channel, please do well to subscribe and join the family. And I promise you, you would not regret it at all, at all. Because here on this channel, it's about growth, babies. It's about growth. We get to learn from each other. Nobody is an island, so we get to learn from each other as much as possible. So until then, I would see you guys in my next video. Okay. Thank you so much for staying by, and see you guys in my next video.